Happy Sunday, everyone. Today we're talking about physician leadership driving transformative care, how it's so important to have physician leadership, and why is that? We're talking to a special guest today, but first I want to tell you, my name is Dr. Elsie Combs, the founder of Lead Physician Leadership Program. We are starting in September 12th, so reach out to me and stay till the end for information if you're interested in that. I'm also the CMO of American Endovascular and Amputation Prevention. Go to our YouTube channel where we host the videos. You can see all the slew of videos from great speakers who've been on here on our YouTube channel called Lead Physician, and also get notified if you subscribe for any future videos. Lead Physician is all about bringing passion, purpose, and potential back to our physicians. Today I'm going to be talking with Dr. Gordon Chen, and Dr. Chen is the Chief Medical Officer of ChenMed. This is a very well-known entity. He's a value-based transformative care organization with about 100 centers and growing. He's also the co-author of this book called The Calling, a memoir of family, faith, and the future of healthcare. And I'm going to be showing you this book right here. I'm discussing this book with him about why he's written it, why is it important that we need physician leadership, and how can physicians be living a much more happier, less stressful, more impactful life, doing the things that we all wanted to do, and why we went to medical school in the first place. So without further ado, let me bring in Dr. Gordon Chen. Hi, Gordon. Thank you so much for being here.
Hi, Elsie. Pleasure to be here. Thanks for having me on.
Yeah, so you are the Chief Medical Officer of ChenMed, and you've written this book. Can you tell us a little bit about, I have the book right here in front of me. Excellent book. Get it on Amazon, everyone. And it talks about how you're able to build, you go from fee-for-service to 100 transformative, or what would you call value-based setting, and continuing to grow and recruit people, having very happy physicians. Tell us about your story.
So we have a vision to be America's leading primary care provider, transforming care of the neediest populations. That's the ChenMed vision, where we're trying to get to. And what the book describes is our why. Like, why did ChenMed come into existence? What are we trying to do? What is our purpose? And so if I were to summarize our why and give you the cliff notes of the book, right?
Yes, please.
ChenMed was birthed out of suffering. What do I mean? ChenMed was birthed out of suffering.
Birthed out of suffering, yep.
And what I mean by that is, as a family full of doctors, having to really struggle and suffer through a broken healthcare system, really fighting for my dad's life. And let me just briefly share that story. My father had a little bit of numbness on his upper lip. This is almost 20 years ago, when he was 54 years old, as a primary care provider in an inner city community in Miami Gardens, taking care of old, poor, sick patients. And that numbness led to a biopsy, which led to a doctor saying, you have less than 2 months to live. You have an incurable carcinoma. The mass is encroaching upon your brainstem. Get your affairs in order. This is not good. And so I get a phone call, Gordon, come pick me up. I'm like, what do you mean come pick you up? And he had heard the news and he couldn't drive because he was just trembling, just thinking, wow, imagine being perfectly healthy and then being told you have 2 months to live. And so for our family, it just shook our world. And we suffered because we just realized how vulnerable life is. Our loss of control. We suffered through a broken healthcare system, like ER visits for blood clots, neutropenic fever, seizures, even a stroke, and just trying to kind of figure out how we're going to help Dad make it. He ended up having a misdiagnosis, and he went from needing surgery to needing chemo and radiation. Can you imagine if we didn't get a second opinion? It was just crazy, right?
No.
And we're still struggling. At that time, we were still struggling to help him to survive, stage 4 cancer. And let me just say thank God, my dad is cancer-free today. He's still working with ChenMed.
Thank God.
But what that did, that allowed us as a family to experience how broken the healthcare system is, and made us face the reality of what our patients go through every day fighting for their life. And they may not be from a family full of doctors, have the education, the resources, the connections in the field. And we had to think, who's fighting for them? Who's fighting for seniors who are really the most vulnerable? They're in the last stage of their life. And all over the country, they're going to the ERs for their care. They're not given a proper chance to make it.
Yep.
And healthcare, I mean, we're trying to do things right, but the system is so broken.
Right.
And so ChenMed was birthed from a family full of doctors experiencing what it's like to fight for your life.
Yep.
And just having a heart full of gratitude and appreciation for God just saving my dad. Right?
Yeah, you know, I just want to say that I want to show this picture from your book, that if it weren't for the fact that you're a family full of doctors, there's no way he probably would have had that radical surgery of his face for what appeared to be squamous cell carcinoma, but it ended up being lymphoma. And I just wanted, this was moments before, after that he found out that he really has lymphoma and not squamous cell. I just want to say that, can you imagine what the regular Joe has to deal with, you know, who's elderly and has this diagnosis and really could have had a different, way of treatment and live.
I mean, Elsie, you flashed that picture of my wedding. That was a 24-hour wedding that we had because we thought my dad would have his face removed, to get to the mass behind his nose. And It was at this wedding. I literally called Jessica, my wife, and I said, "Do you want to get married tomorrow?" Because I don't know if my dad's going to be here. I don't know if he's going to have a face. Let's just get married. Yeah. And then at that wedding, a pathologist called from Houston, MD Anderson, second opinion, and said, "I think the diagnosis is wrong. I think this large B-cell lymphoma, he's got hope." And that was the best wedding present I could have gotten. So you can imagine the roller coaster of emotions and, emergency wedding and suffering to fight for my dad's life. Yeah. And then coming out of that with this passion.
Your dad came out of that with that passion I saw in the book. He's telling his sons, we've got to change the way healthcare is.
That our whole family really came together to fight for my dad's life. And coming out of it and just saying, hey, we need to make this right. We need to do something about this. So from one center, we continue to grow. People told us healthcare couldn't scale. We showed that healthcare could scale. So we're in 15 states right now. We were the first organization to really go into needy communities and show that you can do this in a sustainable and successful way. Yep. If you build on the right model.
Yep.
And so we are a full risk practice, which means that when we prevent hospitalizations, we can use the savings to invest back into prevention, into primary care, into technology, into physician leadership development, right? And that then empowers more growth. Yep. And so, Elsie, you and I were talking earlier, there's the majority of our country, which is transactional, fee for service, right? This is where physicians are just paid to create transactions that improve revenue for whatever hospital systems or whatever system that they're working for. And there's this move to try to get to value because we know that there's a better way. It's just the transactional way isn't working. It's impersonal. It leads to burnout.
Why aren't more people doing it then? Why aren't more people doing value-based or, first of all, you're talking about transformative care versus value-based care. A lot of people know what value-based care is. Can you talk about the difference? And then tell us, why is it that we don't have more healthcare? And I kind of know because I've been studying this, but I want to know in your words, why don't we have more of this?
Yeah. So when you think of fee-for-service, the first step out of fee-for-service is value-based care. And oftentimes, although it's a great first step, it can be very frustrating for physicians. Like complex agreements with many different payers and the value-based contracting arrangements, like kind of scratch the surface of what it could be, but it's very difficult for physicians to manage that amount of complexity. It requires data, it requires a team-based effort, and it requires time and focus. And oftentimes, practices that go into value, the majority of their time is still on fee-for-service.
Got it.
So it's hard for physicians and clinicians to fully mentally transition out of a transactional mindset and start to think about value. Okay. No. So when you move from value-based care into something that is more, let's call it all in, like an outcomes-based care model, that means you start getting rewarded when you prevent hospitalizations, when you prevent heart attacks and strokes, when you serve patients better, when you influence them to change their behavior so that they can achieve better health. I call that outcomes-based care.
Yep.
It's an extreme version of value-based care. It's not where you have one foot in one boat and one foot in the other boat. It's all in.
It's all in.
An outcomes-based model. And for us, we've been doing that on Medicare Advantage full risk arrangements. And that gives us the flexibility to say, hey, we're accountable for the total cost of care. How are we going to use our resources to serve patients better, but then also do it in a way where doctors can have joy and meaning and purpose?
Yeah,
and
let's
so
talk about that,
yeah.
Gordon, because that's very interesting. Doctors are not practicing medicine the way they want to. We see it all over the news. Everybody talks about burnout. They talk about too much, fee for service, meaning see more patients, do more services, get more procedures. You're not doing enough. These are your numbers. Talk about how the life of a physician in your practice is like compared to that.
So in our practice, it's very different. First of all, the investment that we make into physicians, clinicians, as people, as humans, as influencers and leaders is tremendous. What do I mean by that? So when clinicians come on, let's say a primary care provider comes on board, we invest intensively in them. How do we connect them, number one, to their purpose, figure out their why, and then pour into them to help them to develop the influence skills that they need to be successful in our model? Now, from fee-for-service and transactional care to even value-based care where there's still more complexity, confusion, it requires physicians to think differently. Now, when you're talking about outcomes-based care and transformative care, it requires a tremendous investment in helping physicians have the right tools and skills to lead themselves and lead others, right? There are mindset shifts that need to occur. And physicians need to understand that accountability is the doorway to leadership. And so having that accountability mindset to say, even though I don't control everything, I'm going to influence and I'm going to take accountability for patients' health, for patients' outcomes. That is the pathway to leadership. That's just so critical. So at ChenMed, what we do, 4 weeks of intensive training, which physicians love. They actually love to get poured into and to get developed and to learn how to influence, right? And then we continue with about a year of black belt training, 7 different stages of black belt training, which is essentially a fellowship in leadership, in value-based care and outcomes-based practice, and then helping them to demonstrate that they can take a small panel of patients and help them to live longer and live better. Right.
And how do these physicians, kind of sound scary when you say black belt, but I know, having met so many physicians, that in general, physicians want leadership training. They want it. So tell us a little bit about what kind of feedback you're getting from physicians who get this training at ChenMed.
So the training that they get at ChenMed, we've heard it's life-changing. it's transformative not just for their patients, but for them personally. Because in medical school and training, we're trying to learn so many skills and so much knowledge that other parts of our brain that maybe don't get as much investment, like the emotional component, the relational component, the social component, like all of those things are critical for people's development. And so once they start tapping into that, I mean, I've had physicians say, "Hey, if I had gone through your training, like I wouldn't have gotten a divorce," right? Like physicians will say, "Hey, this
I
would
was
have
going
helped me
to ask you.
personally,"
Mhm.
right? But then it goes further, because just the year of black belt training, and we call it black belt training because there are different levels and different skills that you get when you come out of that,
Yep.
and you should be able to help a panel of patients achieve longer and better life after going through that training
Yep.
while developing yourself as leader. But then it continues further on. Like ChenMed, we are investing more in physician leadership development by far than any other organization in the world. Like
Because
by
you
far.
need to. You need to, because you know what?
Because we
Healthcare
have
needs
to.
physician
Right.
leadership. Physician, the only way you're going to succeed in this healthcare climate with healthcare transformation, skyrocketing costs, is to move towards transformative care. We all know that. It's just hard to do. And the reason why it's hard is because we're not developing our physicians into leaders. And I wholeheartedly see, I knew you were going to say this, but when we teach physician leadership skills, their entire life changes. And so we keep talking about this 50 to 60% burnout rate. This is the answer to, this is the key to healthcare in the US and globally.
Totally agree. So there are three main things that need to change, and we need to help accelerate that change. One is we need to get in the right payment model so that we win when patients achieve better health as physicians and clinicians, right? Number two, we need to help physicians and clinicians close that gap in their own personal leadership development, which helps them to lead and influence others. Physicians like to be led by other physicians, right? So we need to help close the gap in physician leadership development. The third piece is we need the right technology and data platforms to help us to succeed in this, because you cannot practice in a full risk model blindly. You need price transparency. And so these three keys to helping us to get to a transformative care approach across America. When I say transformative care, what I mean is taking the outcomes-based care mindset and scaling it across America and beyond so that we can literally transform our healthcare system. And for that to happen, again, we need to pour into physician leadership to help unleash the full potential. Now, what I've found is when you pour into physicians, they love it. Right? This is why our physician leaders, they grow with us, they stay with us, they pour into other physicians, because when you change someone from the inside, then you have a lasting change, and then you become part of a movement that's bigger than yourself, and you can see it happening every day. So I'll give you an example. At ChenMed, we're growing about 30 to 40% year over year. And that's a doubling rate of less than 2 years. So when you're doubling, you have to develop other leaders. You have to scale leadership. And so you combine the opportunity to get poured into not only through black belt training, through preceptorship, mentorship, executive coaching, right? And you pour into your leaders, but then you give them an opportunity for that experiential leadership training, which is so critical. And then that's where you get this just beautiful virtuous cycle where not only are physicians growing and developing, but they're transforming patients, panels, communities, states, and then America.
Thank you so much for that, Gordon. I really appreciate this. We're going to wind this up. I just wanted to show some web pages here. This chenmed.com is where you can go and learn more about ChenMed. Chenbooks.com is where you can find out about the books that have been written and how to buy them. You can buy it on Amazon. Again, it's called The Calling is the book. The Calling, a Memoir of Family, Faith, and Future of Healthcare. Very interesting, and a forward by John Maxwell. And one last thing is I want to show people that if you're a physician who's interested in joining ChenMed, if you go to the website, there is a physician career interest page that you can fill out, right, Gordon?
Yeah, that's right. Go to chenmed.com/physicians, and you could, you can get whatever you need to learn more about ChenMed. We are always looking for top physician talent, clinical talent. And so we're in Florida, in Texas, in the Carolinas, in Virginia, in Pennsylvania, in Ohio, Missouri, Tennessee, Kansas, Illinois. We continue to grow and expand. And so if you have any interest, please visit chenmed.com. The other thing, Elsie, thanks for the shout out about the book. We are on Amazon. All proceeds go to our ChenMed Cares, which is our employee assistance program. But then also, John Maxwell has international ministries that we partner with him to support. And so the proceeds will go to, to nonprofit ministries to help support folks in need.
That's so awesome. Thank you so much. Thank you, everybody, for watching. And thanks for people who've approached me for supporting. If you have a topic on physician leadership, please reach out to me at info@drlcco.com. I'd love to hear from you and share your story. And if you're interested in leadership, again, this increases your value in this type of healthcare environment. Go to leadphysician.org. You want to be part of this transformation. Be transformative yourself. At leadphysician.org, we start out in September, and you can reach out to me for any call if you want. Any last words of wisdom for us, Gordon, as we close?
I just want the physicians that are listening, the clinicians as well, great nurse practitioners too, go out and just discover how high you can reach, how far you can go. Don't settle. There's so much that we can do together to reach our full potential. God bless you, everyone. Thank you.
Thank you, everybody.